message.
As President Barack Obama wraps his 3-day tour across the battleground state of Iowa, one of the major issues on the trail for both the president and his competition, Mitt Romney, has been health care.
You know that every time you get a paycheck, you see there's a deduction there. It's going to Medicare.
When it comes to health care, I guess he used to agree with me because he had the same health care plan that I did in Massachusetts.
In Davenport, Iowa, seniors stretch to the oldies, shoot pool, sip on coffee, and yes, talk politics, which is serious business here in Iowa.
And I don't trust Obama any farther than I can throw him.
The hallways of this senior center are loaded with opinions about both candidates.
Mitt Romney, whatever his name is, he's been born with a silver spoon in his mouth, but he don't know what it is to be poor, you know, or try to find food for your kids or whatever.
Obama has done nothing except spend money, and that's an easy way to make yourself popular, and that's what he's doing. He's buying his votes as far as I'm concerned.
With an aging population and health care reform being so important, senior centers across the U.S. are perhaps the front lines of opinion in this presidential election. Both candidates have polar opposite views. President Obama with his Affordable Health Care Act, recently upheld by the Supreme Court. Mitt Romney and his vice presidential choice in Paul Ryan have another plan: to repeal the president's health care law and do a complete overhaul on Medicare and Medicaid. The difference between the two: Medicare currently guarantees insurance to anyone over 65. That is about 50 million people in the United States. Medicaid is a program that provides insurance for about 60 million people, mostly low-income families, children, and the disabled, many of whom are in nursing homes. For some seniors, all of this reform is hard to imagine.
Yeah, it would affect us greatly. You know, you'd have to cut down. Right now, you have to shop around to see which is the cheapest place to buy food.
Under Paul Ryan's Medicare proposal, future retirees would need private insurance, of which President Obama says would force seniors to pay an extra $6,400 a year. At the same time, the Romney-Ryan Medicaid proposal is to have states take it over and reduce spending on the program by about $800 billion over 10 years. And remember, that's the insurance for the 60 million people with low incomes and some with disabilities, of which 1 in 5 of those people in Paul Ryan's home state of Wisconsin are currently on.
If they have a cutback on that, what are these poor older people going to do? How will they get the money to pay for that, you know, for hospital bills and this and that?
I hate to see the thing get cut. I think it's a good program, but it just needs to be better managed. And I think we should have the people out there to do it.
Other seniors here in Davenport side with the private insurance option.
The need of the American people is to be responsible for themselves and not depend upon the government to provide all the benefits. It's bankrupting our country, and so I'm very concerned about that.
With economic instability in America, rising costs of prescription drugs, and an over 65 population on the brink of doubling, healthcare is a top-shelf topic in the race for the White House, and it's clear that the issues are wide and deep. Robert Ray, Associated Press, Davenport, Iowa.
With liberty and justice for all.